Question 1. Which of the following is the most critical principle to follow when ensuring radiation safety for both workers and the public in a radiology setting? A. Increasing the exposure time while maintaining appropriate shielding. B. Following the ALARA as low as reasonably achievable principle. C. Minimizing the use of lead aprons during imaging procedures. D. Relying on visual observation rather than measuring radiation levels. Answer: B. Following the ALARA as low as reasonably achievable principle. Explanation: the ALARA principle is fundamental in radiation protection to minimize radiation exposure. It requires radiologic technologists to ensure that radiation doses to patients, staff, and the public are as low as possible, considering all practical factors. This involves careful planning, equipment use, and protective measures to reduce unnecessary radiation exposure. While options A, C, and D may have some relevance in specific contexts, they do not address the comprehensive principle of radiation safety that ALARA embodies, which is widely recognized and required by regulatory bodies like the International Commission on Radiological Protection (ICOP) and the National Radiological Protection Board (NRPB). Therefore, B is the most appropriate choice. Question 2. Mr. Smith, a 60-year-old patient, is undergoing vacant to evaluate his abdominal region. He has a known history of renal failure and is allergic to iodine-based contrast agents. What should the radiologic technologist do before proceeding with the scan? A. Administer a low dose of iodine contrast, as it is generally safe for older patients. B. Inform the physician of the patient's allergies and renal history and ask for an alternative contrast agent. C. Proceed with the standard iodine contrast injection as planned. D. Perform the scan without contrast, assuming no serious issues will arise. Answer: B. Inform the physician of the patient's allergies and renal history and ask for an alternative contrast agent. Explanation: before proceeding with any imaging procedure, particularly CT scans that involve contrast agents, the radiologic technologist must confirm the patient's medical history and allergies. In this case, the patient has a known allergy to iodine-based contrast agents and renal failure, both of which make using agents a significant risk for contrast-induced nephropathy. Sin. The correct approach is to consult with the physician and explore alternative contrast agents or imaging techniques, e.g., MRI or ultrasound, that may not require the use of iodine-based contrast. Option is inappropriate, as the contrast agent should not be administered without consulting a physician due to the patient's medical conditions. Option C disregards the potential for severe allergic reactions and renal complications. Option D is not ideal because the physician might determine that contrast is necessary, and the technologist should not make such decisions independently. Question 3. Scenario-based. MS. Davis, a radiologic technologist, is preparing for a fluoroscopic procedure on a patient who is pregnant, though she is unaware of the patient's pregnancy. After starting the procedure, the patient reveals that she is in the early stages of pregnancy. What should MS. Davis do next? A. Continue with the procedure as planned, as early pregnancy is not a significant concern. B. Immediately stop the procedure and seek guidance from the physician or senior staff to assess the risks and determine if continuation is safe. C. Ask the patient to leave and reschedule the procedure at a later time when she is no longer pregnant. D. Adjust the imaging equipment settings to reduce the exposure time and continue with the procedure. Answer: B. Immediately stop the procedure and seek guidance from the physician or senior staff to assess the risks and determine if continuation is safe. Explanation: in situations involving pregnant patients, the safety of both the fetus and the mother is paramount. Ionizing radiation, such as that used in fluoroscopy, can pose potential risks to fetal development, especially during the early stages of pregnancy. The standard procedure is to halt the imaging procedure immediately upon discovering pregnancy and consult with the physician to assess the situation. The physician will determine if an alternative imaging method, such as ultrasound or MRI, should be used or if it is safe to proceed with the procedure. Strict radiation dose management. Option is incorrect as it disregards the potential harm to the developing fetus and the importance of patient disclosure. Option C is inappropriate because rescheduling may not address the immediate need for an assessment. Option D is not safe as reducing exposure may still result in a risk to the fetus and consultation with a physician is needed. Question 4. What is the primary function of personal protective equipment (PPE) in radiation protection during imaging procedures? A. To completely eliminate any potential radiation exposure to the technologist and patient. B. To reduce the amount of radiation exposure to the worker and the patient as much as possible. C. To increase patient comfort during imaging procedures. D. To comply with hospital policy without affecting radiation safety. Answer: B. To reduce the amount of radiation exposure to the worker and the patient as much as possible. Explanation: personal protective equipment, PPE, such as lead aprons, thyroid shields, gloves, and lead glasses, plays a critical role in minimizing the radiation dose that radiologic technologists and patients receive during procedures. While it does not completely eliminate exposure, it significantly reduces the amount of radiation that reaches the body. This reduction is essential for following the ALARA as low as reasonably achievable principle. PPE does not guarantee zero exposure, but it provides a vital protective measure, especially for workers handling radiation or those close to the radiation field. Therefore, option B is the correct answer. Question 5. Which of the following biological effects is most associated with high-dose radiation exposure to tissues during radiation therapy? A. Decreased blood pressure. B. DNA damage leading to cancer or mutations. C. Increased heart rate. D. Reduced oxygen supply to tissues. Answer: B. DNA damage leading to cancer or mutations. Explanation: high-dose radiation exposure, particularly during radiation therapy, primarily affects cellular DNA, which can result in mutations or cancer. Ionizing radiation has the ability to break molecular bonds, leading to direct or indirect DNA damage. This damage can cause mutations, genomic instability, or cancerous transformations in cells. Other effects, such as changes in blood pressure or heart rate, are not directly linked to radiation exposure at the cellular level, especially not to the extent of the effects on DNA. Option B is the most accurate response based on the biological effects of ionizing radiation. Question 6. Scenario-based. Mr. Richards, a 50-year-old patient, is scheduled for a chest X-ray to assess potential pneumonia. However, he has been smoking for over 30 years and has a history of chronic obstructive pulmonary disease, COPD. During the X-ray procedure, the technologist notices a large shadow on the image which may suggest lung cancer. What should the radiologic technologist do next? A. Document the findings on the radiographic report and proceed with the next patient. B. Inform the radiologist immediately, providing them with the image for further assessment and diagnosis. C. Ignore the findings as the shadow is likely related to the patient's COPD. D. Ask Mr. Richards to come back at later time for repeat X-ray to reassess the condition. Answer: B. Inform the radiologist immediately, providing them with the image for further assessment and diagnosis. Explanation: radiologic technologists are responsible for capturing high-quality images but are not qualified to make definitive diagnoses. In the case of unexpected findings, such as a potential shadow indicating lung cancer, it is crucial to inform the radiologist immediately. The radiologist will then review and correlate it with the patient's clinical history, which is essential for making an accurate diagnosis. Ignoring the findings or attempting to reassess the image without professional consultation could delay diagnosis and treatment, putting the patient at risk. Therefore, option B is the appropriate response. Question 7. When performing a CAN, what is the most important consideration for ensuring patient safety regarding radiation exposure? A. Limiting the scan duration to reduce exposure time. B. Using the lowest possible radiation dose while achieving diagnostic image quality. C. Increasing the radiation dose to ensure the clearest image possible. D. Using protective lead aprons for all CT procedures, regardless of the area being scanned. Correct answer: B. Using the lowest possible radiation dose while achieving diagnostic image quality. Explanation: in CT scanning, the goal is to minimize radiation exposure while ensuring that the image quality is sufficient for diagnostic purposes. This can be achieved by using dose optimization techniques, such as adjusting the scan parameters, e.g. to current, voltage, and scan length, based on the patient's size and the diagnostic needs, while reducing scan duration, option A, and using lead aprons, option D, are important for some imaging procedures. They do not directly address the main issue of radiation dose optimization in CT. Increasing radiation dose, option C, would be counterproductive to patient safety and contradicts radiation protection guidelines such as ALARA. Question 8. In the context of radiation protection, what is the purpose of collimation during radiographic procedures? A. To focus the X-ray beam to the area of interest and reduce unnecessary radiation exposure. B. To increase the intensity of the X-ray beam for better image quality. C. To eliminate scattered radiation from affecting image quality. D. To reduce patient discomfort during the procedure. Answer A. To focus the X-ray beam to the area of interest and reduce unnecessary radiation exposure. Explanation: collimation refers to the process of adjusting the size and shape of the X-ray beam to match the area of interest. This technique is essential in reducing the amount of unnecessary radiation exposure to surrounding tissues, as it minimizes the irradiation of areas that do not need to be imaged. Collimation also improves image quality by reducing theta radiation, which can degrade the image. Therefore, the primary purpose of collimation is to uh, focus the X-ray beam and protect the patient from unnecessary radiation. Option is the correct answer. Question 9. Which of the following is an example of an ethical consideration that a radiologic technologist must follow when dealing with patient imaging? A. Ensuring that the patient is aware of the potential risks involved in the imaging procedure and obtaining informed consent. B. Offering patients discounts for imaging services based on their financial status. C. Performing additional imaging studies without physician orders to ensure all conditions are explored. D. Using their judgment to modify a patient's medical record to reflect only the positive aspects of the procedure. Answer A. Ensuring that the patient is aware of the potential risks involved in the imaging procedure and obtaining informed consent. Explanation: ethical standards in medical imaging require that patients are fully informed of the risks and benefits of the procedures they undergo. Informed consent ensures that patients are not only aware of the potential hazards, such as radiation exposure, but also that they voluntarily agree to the procedure. This aligns with principles such as autonomy and patient rights. Offering discounts, option B, or modifying medical records, option D, would violate ethical and legal standards, and performing additional studies without orders, option C, could be considered malpractice. Question 10. Which of the following is the primary responsibility of a radiologic technologist in ensuring the quality of radiographic images? A. Only ensuring that the patient is positioned correctly. B. Ensuring that the imaging equipment is functioning properly and performing regular quality control checks. C. Making judgments about the medical necessity of the procedure. D. Adjusting the radiation dose based on the technologist's discretion, regardless of patient size. Answer B. Ensuring that the imaging equipment is functioning properly and performing regular quality control checks. Explanation: radiologic technologists are responsible for the technical quality of the images they produce. This includes ensuring that the imaging equipment is properly maintained and calibrated through regular quality control checks. These checks are essential for consistent image quality and the accuracy of diagnostic results. What positioning, option A, is an important aspect. It is only one part of ensuring high-quality images. The technologist is not responsible for making clinical decisions about the procedure's medical necessity, option C, or adjusting radiation doses at their discretion without consideration for safety protocols, option D. Therefore, option B is the correct answer. Question 11. Which of the following factors can affect the quality of a radiographic image? A. Patient's age. B. Type of radiographic film used. C. Technologist's choice of clothing. D. Time of day the procedure is performed. Answer: B. Type of radiographic film used. Explanation: the type of radiographic film used can significantly affect the quality of the image. Different films have varying levels of sensitivity to X-rays, which can impact the sharpness, contrast, and overall quality of the image. While factors like patient age may affect the clinical considerations of the procedure, they do not directly affect the image quality. The technologist's clothing, option C, the time of day the procedure is performed, option D, also do not influence image quality. Therefore, option B is the correct answer. Question 12. What is the primary purpose of the ALARA principle in radiology? A. To limit the amount of radiation exposure to healthcare workers while improving image clarity. B. To ensure that all radiographic images are performed with the highest radiation dose possible. C. To minimize radiation exposure to patients while achieving the necessary diagnostic image quality. D. To ensure that patients are not subjected to any radiation during imaging procedures. Answer: C. To minimize radiation exposure to patients while achieving the necessary diagnostic image quality. Explanation: The ALARA principle, as low as reasonably achievable, emphasizes minimizing radiation exposure to patients, technologists, and others while still obtaining the necessary diagnostic information. The goal is to use the least amount of radiation possible to achieve a diagnostic quality image, while worker safety is important. The main focus is on patient safety. Option B contradicts the ALARA principle, and option D is unrealistic since radiation exposure is an inherent part of most imaging procedures. Therefore, option C is the correct answer. Question 13, scenario-based. A radiologic technologist is preparing to take a mammogram of a 55-year-old patient with a history of breast cancer in her family. The patient expresses concern about the discomfort caused by the compression of the breast during the procedure. How should the radiologic technologist handle this situation? A. Reassure the patient that the compression is necessary for image quality but avoid offering any additional support. B. Ignore the patient's concerns as the procedure must be completed as quickly as possible. C. Explain the reasons for compression, attempt to alleviate discomfort, and ensure the patient is comfortable throughout the procedure. D. Cancel the procedure as the patient is clearly anxious and unable to handle the discomfort. Answer: C. Explain the reasons for compression, attempt to alleviate discomfort, and ensure the patient is comfortable throughout the procedure. Explanation: it is important for the radiologic technologist to address the patient's concerns and ensure comfort during the procedure, explaining the need for compression, which is crucial for obtaining high-quality mammographic images, helps the patient understand the process and can alleviate some anxiety. Offering support and attempting to reduce discomfort, such as adjusting the compression as needed, is essential for maintaining positive patient experience. Ignoring concerns, option B, or cancelling the procedure without further explanation, option D, could lead to additional anxiety or prevent the completion of the necessary imaging. Therefore, option C is the correct answer. Question 14. In radiologic imaging, what is the role of a contrast agent? A. To decrease radiation exposure during imaging procedures. B. To create a clearer image by increasing the density of certain tissues or organs. C. To improve the speed of the imaging process. D. To eliminate the need for radiation altogether. Answer: B. To create a clearer image by increasing the density of certain tissues or organs. Explanation: contrast agents are used in radiologic imaging to improve the visibility of certain structures, such as blood vessels, organs, or abnormal tissues, by increasing the contrast between these structures and the surrounding tissues. Contrast agents typically enhance the difference in density, allowing for better visualization of the area of interest. Do not reduce radiation exposure, option A, or eliminate the need for radiation, option D. They also do not necessarily affect the speed of the imaging process, option C. Therefore, option B is the correct answer. Question 15. Which of the following measures helps to reduce the risk of radiation exposure to the technologist during fluoroscopy? A. Increasing the X-ray tube's voltage. B. Using lead shielding and wearing protective apparel. C. Asking the patient to leave the room during the procedure. D. Holding the patient in place manually. Answer: B. Using lead shielding and wearing protective apparel. Explanation: fluoroscopy involves real-time X-ray imaging, and technologists are at risk of prolonged radiation exposure due to the nature of the procedure. Using lead shielding, such as lead aprons, thyroid shields, and lead gloves, is an essential measure to reduce radiation exposure to the technologist. Wearing protective apparel is the most effective way to protect the technologist from radiation. Increasing the X-ray tube's voltage, option A, would likely increase exposure, and manually holding the patient, option D, should be avoided due to potential risk. Asking the patient to leave the room, option C, would not be practical for most fluoroscopic procedures. Therefore, option B is the correct answer. Question 16. Which of the following is the most appropriate action for a radiologic technologist to take when encountering an error in the positioning of a patient during a radiographic procedure? A. Continue the procedure and correct the error during image interpretation. B. Immediately stop the procedure, reposition the patient correctly, and repeat the exposure. C. Document the error but proceed without making any adjustments. D. Notify the patient of the error and request their permission to proceed without correcting it. Answer: B. Immediately stop the procedure, reposition the patient correctly, and repeat the exposure. Explanation: when an error in positioning occurs during a radiographic procedure, it is critical to ensure the accuracy of the images. Continuing the procedure with incorrect positioning, option A, can result in inadequate or unclear images, which could compromise diagnostic accuracy. The most appropriate action is to stop the procedure, reposition the patient, repeat the exposure to ensure a high-quality diagnostic image. Option C would lead to the documentation of the error without addressing the issue, and option D would be unethical as the error needs to be corrected to meet clinical standards. Therefore, option B is the correct answer. Question 17. What is the primary purpose of using personal protective equipment (PPE) during radiographic procedures? A. To increase the clarity of the radiographic image. B. To ensure the technologist's comfort during the procedure. C. To protect the radiologic technologist and the patient from unnecessary radiation exposure. D. To comply with hospital policies and procedures. Answer C. To protect the radiologic technologist and the patient from unnecessary radiation exposure. Explanation: personal protective equipment (PPE) in radiology, such as lead aprons, gloves, and thyroid shields, is used to protect both the radiologic technologist and the patient from unnecessary radiation exposure. PPE does not affect the clarity of the radiographic image, option A, or improve the technologist's. Option B. While hospital policies may require PPE, the primary reason for its use is radiation protection. Therefore, option C is the correct answer. Question 18, scenario-based. Mr. Davis, a 60-year-old male patient, is scheduled for a chest X-ray. He has a history of chronic respiratory disease and expresses anxiety about the procedure. He asks if he can be given some form of sedation to help him relax. How should the radiologic technologist respond to this request? A. Inform Mr. Davis that sedation is not typically used for chest X-rays and that he should try to relax without medication. B. Suggest that Mr. Davis speak with his doctor to determine if sedation is necessary for the procedure. C. Offer to administer a mild sedative without consulting the physician, as it may make the procedure easier. D. Reassure Mr. Davis that sedation is unnecessary and proceed with the X-ray without addressing his concerns. Answer B. Suggest that Mr. Davis speak with his doctor to determine if sedation is necessary for the procedure. Explanation: while it is understandable that Mr. Davis may feel anxious, sedation is generally not required for routine chest X-rays. The radiologic technologist should not administer any sedatives without a physician's order. The most appropriate response is to suggest that Mr. Davis consult his physician, who can assess whether sedation is necessary. Offering medication without consultation, option C, is outside the radiologic technologist's scope of practice. Reassuring Mr. Davis without considering his medical needs, option D, may lead to further anxiety or risk. Therefore, option B is the correct answer. Question 19. What is the primary benefit of using digital radiography over traditional film-based radiography? A. Digital radiography reduces the amount of radiation exposure to patients. B. Digital radiography offers better resolution and contrast than film-based radiography. C. Digital radiography eliminates the need for contrast agents. D. Digital radiography is less expensive to implement and maintain than film-based radiography. Answer A. Digital radiography reduces the amount of radiation exposure to patients. Explanation: one of the main advantages of digital radiography, doctor, is that it requires less radiation to obtain an image compared to traditional film-based radiography. This reduction in exposure is achieved through improved sensitivity of digital detectors. While doctor may offer advantages in terms of image processing and efficiency, the primary benefit, reduced radiation exposure. Doctor does not necessarily improve image resolution or eliminate the need for contrast agents, options B and C, and it may not always be less expensive to implement than traditional film-based systems, option D. Therefore, option is the correct answer. Question 20. When should a radiologic technologist use a grid during a radiographic procedure? A. When imaging patients with high body mass or those with excessive abdominal fat. B. During fluoroscopic procedures to enhance image resolution. C. When performing a routine chest X-ray on a healthy patient. D. When imaging pediatric patients to reduce the amount of radiation exposure. Answer A. When imaging patients with high body mass or those with excessive abdominal fat. Explanation: a grid is used in radiography to reduce scatter radiation, which can degrade image quality. Grids are especially useful when imaging patients with high body mass or those with excessive abdominal fat, as these factors can lead to increased scatter. Grids are not typically needed for routine chest X-rays, option C, or pediatric imaging, option, where the patient's size and low body mass may result in minimal scatter. Additionally, grids are not used in fluoroscopy. Option B, as other methods are employed to enhance image resolution in real-time imaging. Therefore, option is the correct answer. Question 21. Which of the following is the most appropriate radiation protection principle to follow when performing an imaging procedure on a pregnant patient? A. Perform the procedure only if absolutely necessary, ensuring the patient wears a lead apron. B. Always avoid performing any imaging procedures on pregnant patients, regardless of necessity. C. Increase the exposure time to ensure better image quality as the patient is pregnant. D. Use the highest available radiation dose to improve the image clarity while taking extra precautions. Answer A. Perform the procedure only if absolutely necessary, ensuring the patient wears a lead apron. Explanation: the most appropriate principle to follow when performing imaging on a pregnant patient is the as low as reasonably achievable, a lower principle. This means that radiation exposure should be minimized to the lowest possible level, and imaging should be performed only if it is clinically necessary. A lead apron should be used to shield fetus from unnecessary exposure. Option B, which suggests always avoiding imaging procedures on pregnant patients, is not practical or medically appropriate, as some imaging may be essential for diagnostic purposes. Option C is incorrect because increasing exposure time can result in unnecessary radiation. Option D is incorrect as the goal is not to increase radiation doses but to minimize them. Therefore, option is the correct answer. Question 22. A patient with a history of contrast allergies is scheduled for awakening with contrast. What is the most appropriate course of action for the radiologic technologist to take? A. Proceed with the CT scan and administer the contrast agent without additional precautions. B. Inform the physician and consult with them about using an alternative contrast agent or premedication. C. Reassure the patient that the contrast agent is safe and proceed with the procedure. D. Avoid performing the CT scan and refer the patient to another imaging department. Answer B. Inform the physician and consult with them about using an alternative contrast agent or premedication. Explanation: if a patient has a history of contrast allergies, the radiologic technologist must not administer the contrast agent without consulting with the physician. The physician can assess the risk and determine whether an alternative contrast agent or premedication is needed to minimize the allergic reaction. Option is incorrect because proceeding without addressing the patient's history of allergies could lead to severe adverse reactions. Option C is not appropriate as the technologist should not reassure the patient without a clear plan of action from the physician. Option D, while cautionary, is unnecessary as the scan can be safely performed with proper precautions. Therefore, option B is the correct answer. Question 23, scenario-based. MS. Carter, a 40-year-old woman, arrives for a mammogram. She reports having had breast implants for cosmetic reasons. The technologist is unsure about the best approach to obtain clear images while ensuring the safety of the patient. What should the technologist do? A. Perform the mammogram in the standard manner without making any adjustments as implants don't affect imaging. B. Perform modified mammogram technique including compressing the breast tissue behind the implants to obtain clearer images. C. Avoid performing the mammogram entirely as breast implants pose risk for image distortion. D. Ask the patient to remove the implants for a clearer view of the breast tissue during the mammogram. Answer: B. Perform a modified mammogram technique including compressing the breast tissue behind the implants to obtain clearer images. Explanation: when performing a mammogram on a patient with breast implants, special techniques are required to ensure both clear imaging and patient safety. The technologist should use a modified positioning technique that involves compressing the breast tissue behind the implant to get a more accurate image of the breast tissue. Option is incorrect because simply performing the standard technique without adjustments may result in inadequate imaging due to the implants. Option C is also incorrect as mammography with implants is a common procedure when performed with proper techniques. Option D is not appropriate as the patient cannot be asked to remove implants for imaging purposes. Therefore, option B is the correct answer. Question 24. What is the primary purpose of performing quality assurance (CARM) testing in a radiology department? A. To ensure that the radiology equipment is cleaned and sanitized regularly. B. To ensure that the imaging equipment is functioning properly and producing high-quality images. C. To ensure that the staff are following ethical guidelines and patient privacy laws. D. To monitor and track the number of procedures performed by each technologist. Answer: B. To ensure that the imaging equipment is functioning properly and producing high-quality images. Explanation: quality assurance testing in a radiology department is performed to ensure that the imaging equipment is operating effectively and producing high-quality images that are diagnostically useful. Proper testing involves checking calibration, image quality, and ensuring that the equipment is within the manufacturer's specifications. Option is incorrect because while cleaning and sanitizing are essential for infection control, they are not the primary purpose of testing. Option C pertains to ethical and legal concerns, which are important but are not the focus of CARE. Option D is unrelated to CARE testing, which focuses on equipment performance, not individual staff performance. Therefore, option B is the correct answer. Question 25. Which of the following best describes the concept of radiation dose optimization in medical imaging? A. Increasing the radiation dose to improve the image quality and accuracy of the diagnosis. B. Decreasing the radiation dose to the lowest level that still provides diagnostic quality images. C. Using the same radiation dose for all patients regardless of size or clinical need. D. Avoiding the use of radiation altogether, even when imaging is necessary. Answer: B. Decreasing the radiation dose to the lowest level that still provides diagnostic quality images. Explanation: radiation dose optimization refers to the practice of minimizing radiation exposure to the patient while still achieving the required image quality for accurate diagnosis. This is done through techniques like using low radiation doses, adjusting exposure parameters, and utilizing shielding where appropriate. Option is incorrect because increasing radiation dose unnecessarily increases the patient's exposure without any clear benefit. Option C is incorrect as the radiation dose should be adjusted based on patient size and clinical need. Option D is not practical as many diagnostic imaging procedures require radiation for accurate diagnosis. Therefore, option B is the correct answer. Question 26. A 65-year-old patient presents for oecania of the abdomen. The patient has a history of diabetes and is on oral medications for control. The radiologist has ordered the use of intravenous contrast for the procedure. Which of the following is the most important consideration for the radiologic technologist before administering the contrast? A. Verify the patient's weight to ensure the proper contrast dosage. B. Confirm that the patient is fasting for at least 12 hours before the procedure. C. Review the patient's creatinine levels to assess renal function. D. Ask the patient to take their oral diabetes medication before the procedure. Answer: C. Review the patient's creatinine levels to assess renal function. Explanation: before administering contrast agents to a patient, it is important to assess kidney function, as contrast agents can potentially cause nephrotoxicity, particularly in patients with pre-existing renal issues. The creatinine levels are a key indicator of renal function. Option is not directly relevant, as weight is not typically the primary factor in determining contrast dosage. Option B is unnecessary unless specifically instructed by the physician, as not all CT scans require fasting. Option D is incorrect, as oral diabetes medications should be managed by the physician, especially regarding the timing of administration when contrast is used. Therefore, option C is the correct answer. Question 27, scenario-based. A 35-year-old pregnant woman comes to the radiology department for a chest X-ray. She is concerned about the safety of the procedure due to her pregnancy. What should the radiologic technologist do to address her concerns? A. Explain that the radiation dose from a chest X-ray is minimal and reassure her that the procedure is safe for her pregnancy. B. Cancel the procedure and schedule an ultrasound instead. C. Offer to reschedule the procedure after the pregnancy, as X-rays should not be performed during pregnancy. D. Obtain the physician's approval before proceeding with the exam. Correct answer: A. Explain that the radiation dose from a chest X-ray is minimal and reassure her that the procedure is safe for her pregnancy. Explanation: while radiation exposure during pregnancy should be minimized, a routine chest X-ray involves a relatively low dose of radiation and is generally considered safe for the fetus, especially when proper shielding is used. The technologist should explain the minimal risks and reassure the patient. Option B is unnecessary unless there is a contraindication for the X-ray, which in most cases there is not. Option C is an overcautious approach, as chest X-rays are commonly performed during pregnancy when necessary. Option D is also unnecessary unless specific concerns are raised. Therefore, option is the correct answer. Question 28. A patient undergoes a fluoroscopic procedure. Which of the following is the most effective method for reducing radiation exposure to both the patient and the healthcare worker? A. Decrease the frame rate of the fluoroscopy. B. Increase the fluoroscopic imaging time to improve clarity. C. Use lead shielding for both the patient and healthcare workers. D. Perform the procedure without any shielding to avoid discomfort. Answer: C. Use lead shielding for both the patient and healthcare workers. Explanation: using lead shielding is one of the most effective methods for reducing radiation exposure during fluoroscopic procedures. Lead aprons, thyroid shields, and other protective devices help minimize unnecessary radiation exposure to both the patient and healthcare workers. Option is not a correct approach because reducing frame rate can compromise the quality of the procedure, potentially increasing the need for repeat exposures. Option B is incorrect as longer imaging times increase radiation exposure. Option D is not advisable as shielding is crucial for minimizing radiation risk. Therefore, option C is the correct answer. Question 29. Which of the following techniques can help improve image quality in digital radiography while minimizing patient exposure? A. Increasing the exposure time. B. Increasing the kilovolt kV and decreasing the milliampere seconds mass. C. Decreasing the kilovolt kV and increasing the milliampere seconds mass. D. Using the lowest possible kV and mass settings without compromising image quality. Answer: B. Increasing the kilovolt kV and decreasing the milliampere seconds mass. Explanation: to improve image quality while minimizing patient exposure, it is generally advisable to increase the kilovolt kV to improve image contrast and penetration while reducing milliampere seconds mass to lower the radiation dose. Increasing kV reduces the need for high mass settings, which in turn minimizes patient exposure. Option is incorrect as increasing exposure time can result in unnecessary radiation. Option C may result in insufficient image quality due to low kV, while increasing mass would increase exposure. Option D, while sounding safe, is not always achievable without sacrificing image quality. Therefore, option B is the correct answer. Question 30. During a radiographic procedure, the technologist notices a possible image artifact. What is the first step the technologist should take to address the issue? A. Immediately retake the image without investigating the cause. B. Attempt to identify the source of the artifact before deciding whether a repeat image is needed. C. Ignore the artifact as it will not impact the diagnosis. D. Cancel the exam and refer the patient to another department. Answer: B. Attempt to identify the source of the artifact before deciding whether a repeat image is needed. Explanation: when an artifact is identified, the first step should be to investigate the potential source. Artifacts can be caused by various factors such as patient movement, positioning errors, or equipment malfunction. Identifying the source allows the technologist to determine whether a repeat image is necessary. Option A is incorrect as retaking the image without identifying the cause may result in repeated artifacts. Option C is not advisable as even small artifacts can impact image quality and diagnostic accuracy. Option D is not necessary unless there is a significant issue with the equipment or procedure. Therefore, option B is the correct answer.